Today's presentation will be by Dr. Jamie Lewis, who's an associate professor in the Department of Surgery, the Division of Surgical Oncology. She will be talking about Cancer Wasn't Canceled, Improving Surgical Technique Despite the Healthcare Shutdown. Thank you, Jamie.
Thank you so much for having me, and thank you all for joining us. The COVID-19 pandemic started slowing down our surgical practices in late March of this year. By April, we had come to nearly a complete halt. Most elective and preventative procedures and visits were on hold in order to protect both our patients as well as our providers from exposure, as well as to conserve resources, especially personal protective equipment for use in the event of a massive local outbreak of coronavirus. During this time, we also shut down many of our operating rooms. We limited use only to performing procedures for patients with conditions that were immediately life-threatening. However, because we never saw a huge influx of COVID-19 patients locally, we were able to continue operating on patients whose conditions were not immediately life-threatening, but for whom treatment could not be indefinitely delayed to the end of the pandemic. During this time, we triaged care of those patients diagnosed with breast cancer. We deferred surgical interventions for many patients who had a low risk of progression over the duration of the pandemic. We recommended endocrine therapy for some patients with early stage hormone positive tumors. Some received chemotherapy, while those who had no alternative to surgery were able to proceed. We did, however, limit the procedures that some of these patients could undergo. For example, those patients who were candidates for breast conservation were only offered this option. We didn't perform any prophylactic surgeries, and if patients required reconstruction for mastectomy, they were only offered tissue expanders or implants. Despite the slowdown and partial shutdown, we were able to move forward with new technology for performing imaging localized breast surgery. These are procedures that are performed in the breast or lymph nodes for lesions that cannot be felt on physical exam. They require placement of a device that guides the surgeon to whatever needs to be removed. These are generally placed prior to the procedure by a radiologist using mammogram, ultrasound, or MRI guidance. These are images of standard needle wire localizations. For these procedures, needles and wires are placed into the breast or lymph nodes on the day of surgery. The wires then point us to the lesions of interest. While needles and wires work well, they do have some limitations, and therefore additional devices have been developed. A few alternatives to needles and wires are radioactive seeds, radiofrequency label seeds, and magnetic seeds. And more recently, a GPS-like clip, a smart clip, has been developed, which is the one that we have started using here at UC Health. In this image, you can see two smart clips that are in place. These are the larger clips, and these are placed around the biopsy clips that were placed at the time of diagnosis. Once these smart clips are in place, the surgeon then has a 3D view of the location of the clip. And with the knowledge of the location of these smart clips in relation to the lesion of interest, the surgeon can then use these devices to accurately remove the clip as well as the lesions. And in this illustration, you can see how the surgeon can determine the distance, the depth, and the direction of the clip and therefore the lesion from the tip of their electrosurgical tool. Ultimately, then you can see that the lesion or lesions are removed, as you can see on this image. And here in the image, you see again those large smart clips, and they are surrounding the 3 different shaped biopsy clips, as well as the 2 dense lesions and the calcium deposits that are the lesions of interest. And we believe that this new technology ultimately benefits our patients in several ways. It improves efficiency and minimizes delays getting to the operating room because these smart clips are actually placed on a day ahead of the day of surgery. Then the day of surgery, the patient isn't at the hospital quite as long, and they're likely also more comfortable than spending several hours prior to surgery with needles and wires in place. We actually plan to evaluate our own experience and believe that these devices may actually improve additional surgical outcomes, including cosmesis and potentially the need for second surgeries for close or positive margins. Thank you very much.
Thank you so much, Dr. Lewis. It's wonderful to see that we were able to take advantage of that sort of pause on surgery to implement this new strategy and technique. You know, I think you've very nicely discussed some of the advantages. Do you think there are other big pluses for this technique, shorter operating time, or it seems like it's a win-win?
Definitely. We're actually planning to look at our operative times with these smart clips as well, because now our incisions aren't limited by the placement of the needles and wires. It may actually improve operative times as well.
Is it safe for people to have surgery now? You know, the beginning phases of the pandemic, we were in such a shutdown. But I know every day my patients ask me, should I come in for that test that's scheduled? Should I go forward with surgery? Can you comment a bit upon the safety as we now feel it during the pandemic?
Absolutely. Probably the surgical amphitheaters and the preoperative and postoperative areas are some of the safest places to be. We all wear personal protective equipment. The physicians, as well as all the nursing staff and other support staff, wear masks, we wear eye protection, and any patients who come into that area have undergone COVID testing. So we don't operate on any patients unless it's an emergent procedure if they're COVID positive. So you know that the majority of those around you are actually proven to be COVID negative. And as far as I'm aware, we really haven't had any issues with patient exposures for patients undergoing surgical procedures.
Yeah, I think the operating area, and actually most areas of our hospital are extremely safe now. I think our system is trying its best, as are all hospital systems, to keep people safe, both the staff as well as the patients. Yeah.
Absolutely.
So the pandemic has certainly created a lot of havoc. How long do you think this is going to last?
So that's a very good question. My daughter, who's 5, asks that on almost a daily basis because she wants to know when she can go back to Disney again. How long will this virus last? I tell her I don't really know. Truthfully, I think it's going to be 6 to 12 months till we really have an idea of whether this is going to die down or whether it's going to continue on and be a chronic issue. I wish I knew.
Yeah, it's a little bit of an unknown, and we don't have crystal balls, do we?
No.
And then finally, do you think there's been an upside to the pandemic? You know, what's been perhaps the best part about the pandemic? And then the flip side to that, what's been the toughest part for you and your family and colleagues?
So I think the upside potentially is our uses of things like WebEx and Zoom calls, the technology. We do know that we live in a very global environment, and it can be challenging and time consuming to travel. So there's been greater acceptance, certainly, of using technologies. We've been forced to do it. So we do anticipate maybe less travel locally, less travel distantly, which provides a lot of us who already have long work hours and things, a little bit more time at home, a little bit more time with our families, less time in airports and such. On the flip side of that, though, is that we miss those social connections that we gain by traveling both from a business and career perspective, as well as from a family perspective. So certainly the social isolation that we've experienced on multiple levels, I would anticipate is what most people, including myself, would say has been the hardest part of this pandemic. That and just not being able to have some physical contact with our friends and family, and even simple handshakes or potentially hugs with patients.
Yeah. Thank you so much, Dr. Lewis, for providing this new information. If you enjoyed today's mini interview, please pass the word on to your family and friends by using your social media. Next week, actually, I will be talking about continuing breast cancer treatment during COVID-19. Thank you again, and we'll see you next week.